Ever wondered what common illnesses your baby might face and how to recognize them? The world of baby health can be a complex maze filled with a plethora of symptoms and conditions. Understanding these common baby illnesses is crucial. Why? Because early recognition can lead to timely treatment, preventing complications, and ensuring your little one's well-being. From the common cold to ear infections, colic, and gastroenteritis, knowledge is a powerful tool. Knowledge is power, and it's time to empower you about common baby illnesses. A common cold can easily sneak up on your little one. It's a simple truth that can cause a lot of worry for parents, especially those experiencing it for the first time with their babies. So what exactly is a common cold in babies? Well, it's much like a common cold in adults, caused primarily by viruses, with the rhinovirus being the usual culprit. However, the symptoms can appear a little different in our tiny ones. A common cold in babies often begins with a runny nose. You might notice clear nasal discharge that gradually thickens and turns green or yellow. But don't panic, this is quite normal. Alongside, a persistent cough may develop, which can sometimes be a little more worrying to hear, but it's simply the body's way of getting rid of that pesky mucus. Now, while adults often deal with headaches and body aches, babies can't express these symptoms in the same way. Instead, they may seem fussier than usual, have trouble sleeping, or lose their appetite. These are all signs that your baby is not feeling their best. In some cases, a mild fever may accompany the cold. This is the body's natural defense mechanism against the virus. However, if the fever persists for more than 2 days or is unusually high, it's time to call the pediatrician. So how does this differ from an adult cold? Well, while the symptoms are similar, babies have a smaller nasal passage which can become easily blocked. This can make them uncomfortable and can also interfere with their feeding and sleeping. That's why it's so important to keep their nasal passages clear. But remember, a common cold is not usually cause for alarm. It's a part of growing up and helps build your baby's immune system. However, it's essential to monitor the symptoms and consult a healthcare professional if anything seems out of the ordinary. Remember, it's a common cold, but your baby needs your comfort and care. So, hold them, soothe them, and let them know that everything is going to be all right. They'll be back to their giggling, playful selves before you know it. Scene script. Ever heard of baby colic? It's more common than you think. Imagine you've just brought home your newborn. You're overjoyed, but also exhausted. Then your baby starts crying. It's normal, right? But then the crying doesn't stop. It goes on for hours, every day, and nothing seems to soothe your little one. This is the reality of baby colic. So what exactly is baby colic? It's a term used to describe severe, often fluctuating pain in the abdomen that is experienced by babies. The exact cause of colic is unknown, and that's part of what makes it so frustrating. Some theories suggest it might be due to the development of the baby's digestive system, changes in the gut bacteria, or food allergies. Symptoms of colic often appear during the first few weeks of life. The most obvious sign is excessive crying. Your baby may cry for hours on end, often in the late afternoon or evening. The crying often seems to come out of nowhere and can continue despite all your best efforts to comfort your baby. But crying isn't the only symptom. Your baby might also show signs of physical discomfort or fussiness. They might clench their fists, arch their back, or have bloated tummies. Their face might turn red, and they may pass gas more than other babies. It's important to remember, though, that colic isn't harmful to your baby's health. It won't cause any long-term problems. It's more distressing for you, the parent, who has to cope with a seemingly inconsolable baby. So, what can you do? Well, there's no one-size-fits-all solution, but there are strategies that may help. You can try feeding your baby in a quiet, dark room, or rocking them gently. Some babies are soothed by white noise like the sound of a vacuum cleaner or washing machine. You can also try a warm bath or a tummy massage. Remember, it's crucial to take care of yourself too. Reach out to family, friends, or a health professional for support. While colic can be stressful, it's temporary. Your patience and soothing can make a big difference. Ear infections can be quite painful for your little munchkin. They are one of the most common reasons for pediatrician visits, and most children experience at least one ear infection by the age of 3. But what exactly causes these infections? And how can you recognize them? An ear infection, or otitis media, occurs when a bacteria or virus causes inflammation and fluid buildup behind the eardrum. This is often a result of a cold, flu, or allergy, which can lead to congestion and swelling of the nasal passages, throat, and eustachian tubes. In babies, these tubes are smaller and more horizontal, making them more prone to blockages and infections. Now let's talk about the symptoms. Your baby can't tell you their ear hurts, but there are some signs you can look out for. The first and most common symptom is tugging or pulling at the ear. This is often accompanied by a fever, a sign that the body is fighting an infection. Your baby may also be more irritable than usual, especially when lying down, as this can increase ear pressure and cause more discomfort. Other symptoms include difficulty sleeping, a decrease in appetite, and perhaps even some balance problems or hearing difficulties. It's important to remember that these symptoms can be quite similar to other illnesses, so it's always best to consult with a healthcare professional if you're unsure. The good news is, most ear infections are treatable, and your pediatrician might prescribe antibiotics or recommend over-the-counter pain relievers to help ease your little one's discomfort. It's also worth noting that while ear infections are common, repeated episodes could potentially lead to hearing problems or other complications. So if your baby is frequently experiencing ear infections, it's important to have a discussion with your healthcare provider about possible preventive measures. Remember, your baby relies on you to help them feel better. Be observant, be patient, and most importantly, be there for them. Prompt action can save your baby from unnecessary discomfort. Gastroenteritis might sound scary, but it's more common than you'd expect. It's a medical term that simply stands for inflammation of the stomach and intestines. Picture it as a little storm brewing in your baby's tummy, causing some discomfort and upset. Now, what sparks this storm? Most commonly, it's due to a viral or bacterial infection. Viruses like rotavirus or norovirus are often the culprits, but bacteria like E. coli or salmonella can also be to blame. Sometimes it may be due to parasites or even allergic reactions. It's important to remember that gastroenteritis is not a disease in itself. It's more of a symptom of an underlying infection or condition. So if your baby has gastroenteritis, it's a sign that their body is trying to fight off something that doesn't belong there. Now let's talk about the signs of this little storm. The most common symptoms of gastroenteritis in babies include vomiting and diarrhea. If your baby is suddenly producing more watery stools than usual, or if they're throwing up more than you'd expect, it could be a sign of gastroenteritis. But it doesn't stop there. Other symptoms can include fever, loss of appetite, and general fussiness. Your baby might seem more tired than usual, or may have a hard time staying hydrated due to the diarrhea and vomiting. And speaking of hydration, this is where things can get serious. Dehydration can escalate quickly in babies, and it's a major concern with gastroenteritis. If your baby's mouth seems dry, if they're not producing as many wet diapers as usual, or if they seem unusually drowsy or fussy, it's time to seek medical attention. So, what's the takeaway here? Gastroenteritis in babies is common and usually not a cause for panic, but it's crucial to stay vigilant and monitor your baby for signs of dehydration. If you notice anything that concerns you, don't hesitate to consult with a healthcare professional. Remember, when it comes to your baby's health, it's always better to err on the side of caution. Stay vigilant, as dehydration can escalate quickly in babies. So, we've discussed some common baby illnesses today. We started off with the common cold. Sniffles, sneezing, and a runny nose are often the first signs of this ubiquitous ailment. Don't fret though, it's an expected part of your little one's immune system development. Then we dove into the world of baby colic, a condition that can cause distress not just for the baby, but for the entire family. Remember, persistent crying, especially in the late afternoon or evening, might be your cue. But hold on tight, it's usually a phase that passes with time. Next up was ear infections. That inconsolable crying, tugging at the ear, and trouble sleeping could be signaling something more than just a bad day. It's always wise to consult with your pediatrician in these situations. Lastly, we explored gastroenteritis, an inflammation of the stomach and intestines. It manifests through symptoms like vomiting, diarrhea, and dehydration. Hydration is key, but don't hesitate to seek medical advice when needed. In each case, early recognition is crucial. It can make a significant difference in your baby's comfort and recovery. But remember, while it's important to be observant, don't let every sneeze or whimper send you into a panic. Babies are resilient, and with your love and care, they'll navigate these health hurdles. Remember, when armed with knowledge, you're better equipped to ensure your baby's well-being. Before we wrap up this video, we want to take a moment to connect with you, our valued viewers. Your engagement helps us create more informative content tailored to your needs. If you found this video helpful, please give it a thumbs up. This not only supports our channel, but helps other parents find this essential information. If you know someone who might benefit from this video, don't hesitate to share it. Remember, knowledge shared is knowledge doubled. Are you subscribed to our channel yet? If not, we'd love for you to join our community. Click on the subscribe button and make sure to hit the notification bell so you never miss our new uploads. We consistently produce videos to guide you through the exciting and sometimes challenging journey of parenthood. Lastly, we encourage open dialogue. If you have questions, or if there's a topic you'd like us to cover in a future video, please drop a comment below. We're here to support you. Remember, you're not alone in this journey. Together we can make parenting a little less daunting and a lot more enjoyable. Until our next video, stay informed, stay vigilant, and most importantly, stay positive.